Atrial fibrillation is known to cause a 4 to 5-fold increased risk of ischemic stroke. Oral anticoagulation with non-vitamin K oral anticoagulants or vitamin K antagonists are popularly recommended as first-line treatment for reducing stroke risk, but bleeding complications and non-adherence are barriers to effective anticoagulation therapy. Now, device-related thrombus formation, one of the main concerns after an LAAC, is generally reported to be a 2 to 5% cases. Especially, it may develop on the poorly endothelialized device following intervention and have a potential negative impact on the risk of stroke and thromboembolic events. Now, what poses as risk factors of incomplete device endothelialization? Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. I am here to talk about the incidence, potential risk factors and clinical impact of incomplete device endothelialization after a left atrial appendage closure. A recent study aimed to assess the incidence, potential risk factors, as well as the clinical impact of incomplete device endothelialization after a left atrial appendage closure, and it reported that incomplete device endothelialization is common after an LAAC procedure, especially in patients with persistent atrial fibrillation. In the study, incomplete device endothelialization was detected in 64.4% of patients, wherein with incomplete device endothelialization or complete device endothelialization did not significantly differ with respect to baseline characteristics and interventional procedure features. However, the incomplete device endothelialization confers an increased risk for device-related thrombus, but may not be necessarily associated with thromboembolic events and even poor clinical outcomes, thereby providing careful monitoring and continued antithrombotic therapies as given. The study suggests that after a successful left atrial appendage closure procedure, a high proportion of patients develop incomplete device endothelialization, particularly for those with persistent atrial fibrillation, larger left atrial appendage orifice, and even the left atrial size. That's all for today. Stay tuned to Medical Dialogues for further updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.